Hello, I'm Mark Ells, Town Manager in Barnstable, and I'm here to provide you this week's community update. We continue to manage this um, COVID situation here in Massachusetts and certainly across the country. In Barnstable, we've seen increasing positives, and we were notified Thursday, December 3rd, that effective December 7th, we're going to take a step back. Right now, it's a four-phase plan the governor has. We are in phase 3, step 2, but because of the positives, the rising number of positive cases in Barnstable, and the fact that it's been sustained over 3 weeks, we've been notified that we're going to move from step 2 back to step 1. And they're categorizing us on the map as a red designation. So I would encourage you all to take a look in detail at what this means, whether it's personally or professionally. And where you should look is on the mass.gov. And if you look up top, go on their website, mass.gov. And if you look across to the right, you'll see COVID in capital letters. Click on it and then go in there and read the orders and directives of our governor. We're not making up our own. We are following the orders and directives of our governor. So what does that mean? Well, it means our situation will become more restrictive. We're going to step back so that there'll be certain activities that will no longer be allowed. There will be group sizes that will be reduced either in total number or percentage. So I encourage you to go in, take a look, and try to understand the specifics of this. We will certainly be here to try and help answer questions. Our staff, once again, is very actively reviewing this so that we can work with our residents and businesses, especially our businesses, so that they can understand how to stay open and continue to provide service. But this is a concerning trend, and the remedy to this hasn't changed. And number one, we're all waiting for a vaccine. Short of that, wearing a mask, physical distancing, minimizing group size, taking personal responsibility, proper personal hygiene. Nothing's changed. We've been saying this throughout this situation. It still holds true. And I know we've come into the holiday season, and we're fatigued by what we're having to deal with. But the numbers are going in the wrong direction. And we need to be attentive to this. We need to take personal responsibility for it, because we don't want to step further back in a full phase to phase 2. I don't believe that that's the direction that we're contemplating at this point, meaning when we say we, I mean statewide. I'm not hearing that unless numbers escalate further. But we watch it daily and measure it weekly, and seem to be reacting more or responding more based on statewide orders and directives from our governor. So that, I think that will continue as we move forward with this. You've seen our public schools here in Barnstable make a decision to remain remote after the Thanksgiving holiday. They will go back to in class after the 11th, so basically on Monday, the 14th of December. That's their plan at this point. So please keep a close eye on that if you have children in the school system. They've done that so that they could allow for proper quarantining time after the holidays, because in many cases people came from all over, family members came from all over, and we've come together as we always do, and that presents challenges with this situation. And so they felt it best to remain remote, to allow a little more time, as I understand it from our superintendent. She's going to provide you an update that will follow my presentation. And please stay tuned to this. This will remain a priority for us until we move out of this emergency situation. And I assume that will coincide with a vaccine being administered. I do expect that we'll be talking more about that once we get more information on when those vaccines are available. We'll also be providing more information on some remote testing sites, one of which will be in Barnstable, a mobile testing site for our residents in the event that they need to be tested. Hopefully I'll have that ready for my next community update. So stay well, and please continue to adhere to the protocols that we've identified. Wear a mask, properly distance, minimize group size, proper hygiene, and take personal responsibility relevant to responding in this situation. And thank you for listening.
Good day, everyone. This is Superintendent Meg Mayo-Brown with our BPS community update for December 2nd. My update today is as a follow-up to the email I sent out to the community, to our parents and guardians yesterday, about extending our remote learning mode through December 11th. In today's update, I'm going to talk a little bit more about extending our remote learning period and why and how that decision came about. I'll review our current public health metrics, both from state, county, and town, our commitment to in-person learning in the district, and next steps. In terms of how the decision was reached to extend the remote period of learning, came about as a result of conversations with our steering committee. We have a district steering committee that was created in May at that time to provide feedback and input on reopening the district after our closure in March. That school committee has, the steering committee has been together for a period of time now. The membership includes all of our school principals, central office staff, the Barnstable Teachers Association president, the Barnstable Administrators Organization president, 2 school committee representatives, representatives from human resources, finance, transportation, facilities, and food service. We continue to meet regularly as a steering committee to discuss our reopening challenges and our successes. We met last week prior to Thanksgiving to discuss our public health data and the schedule for the post-Thanksgiving week. It was during the steering committee meeting last week where we reached the decision to return from Thanksgiving in a remote period for Monday, Tuesday, and Wednesday of this week, with the commitment to revisit our public health metrics post Thanksgiving. We met again yesterday, December 1st, to take a look at our public health data, and the steering committee met for well over an hour, talking about the pros and cons in terms of remaining remote or returning to in-person as scheduled on December 4th. I would say there was a lot of back and forth, acknowledging the importance of being in person for our students, both academically as well as socially and emotionally as well. There was also great concern for the metrics that we were looking at, and a discussion about the community spread that is occurring with the virus in Barnstable presently. and our desire to prevent in-school transmission at this time as a result of the community spread in our surroundings. So given the feedback and input, it's my role as the superintendent to make a final decision after all of that is vetted. And so I did make the decision that we would continue remote, and we would implement our school committee policy for remote learning. In terms of taking a look at the data that we reviewed yesterday with the steering committee, I just want to share that with everyone at this time. We look at state data, county data, and town data. The state data, this is from the Department of Public Health weekly report dashboard. If you follow the row for Barnstable here, you can see we are considered a red community. And if I can just move this, you can see our positivity rate is very high at 7.8%. So, and the rest of this chart shows the other communities on Cape Cod, and you can see Barnstable right now is the only red community, and we have some yellow and green. Certainly the notation here that the change in case count is higher from the last time the Department of Public Health reported it, as is our test percent positivity. Looking at the county data, this is a chart that the county releases. It's the 3-day average. We'll just ask, it may be difficult to see the numbers here, but we'll just ask that you look at the trend that we're in terms of the number of COVID cases that are rising in the county. Again, this is a 3-day average trend. So we are seeing the cases spike in the county. And then again, looking at our town data, we created this chart. This chart reflects really from when we opened in-person learning in the school district from that period of time. So if we start at the bottom of the chart and work our way up, you see that we've moved from green to yellow to red. The period of time reflects a 2-week range, as it indicates over here. So you can see for approximately 4 weeks, we've been designated as a red community, and the percent positivity for testing has increased as well. The lower portion of this chart reflects the number of cases we've had in the district. Again, these are not in-school cases. They are cases of students that receive a positive test result as out-of-school exposure. Those test results are reported to us so that we can do contact tracing on our end. Again, you can see how our case counts in the schools are have been rising as well. The date here, November 29th, this is reflective of the week that we're in, so that's not the total count, that's the running count as of yesterday. So again, the steering committee discussed all of these pieces of data. Then the conversation continued, and again, I'm wanting to share, so why did we extend the period of remote learning? So there is undoubtedly community spread in Barnstable. That's what the charts on the previous slide demonstrate. We also know that more of our students are testing positive as a result of out-of-school exposure. I would like to say that, as our nurses are doing contact tracing when we're notified of a positive case, we're hearing a bit about some gatherings that our students are participating in that are contributing to some spread. Those kinds of gatherings may include birthday parties, sleepovers, play dates, and things of that nature. So given our knowledge of last week's traveling and gathering due to the Thanksgiving Day holiday, we want our staff and students to quarantine to prevent in-school transmission. So as we say, we have not yet seen any evidence of in-school transmission. We believe, and this is what was discussed at the steering committee meeting, we believe in that our proactive measures now will allow our schools to continue in-person learning in the long run. There is community spread in Barnstable. We want to avoid having that community spread enter the schools, and then we would be in the position of in-school transmission. In-school transmission will close in-person learning. So again, we are taking this measure as a proactive step. Given the community spread in the town, we don't want to see that community spread enter our schools in any way. We're also providing a 14-day quarantine period post-Thanksgiving. Staff and students are required to be in quarantine if there was any travel outside of Massachusetts. When we look at the travel advisory map that's put out by the state, we can see that every state across the country is a red state. With the exception right now, Hawaii is the only exception. Every other state is red, meaning that if any of our students or staff travel to another state, in order to return to school, there is a requirement of a 14-day quarantine or evidence of a negative COVID test as tested through PCR. And then finally, this is the difficulty in delaying COVID testing on Cape Cod. This bullet point here is really to indicate or to acknowledge that on Cape Cod, there is difficulty or delay in getting COVID testing, particularly more recently. We are noticing that our students and staff that are getting tested, those testing appointments are taking longer to be able to get an appointment, and the results, the subsequent results are taking longer for our staff and or students to receive those. So when folks say, why did we extend remote learning? It's really largely because of what you see on this slide. We want to be proactive and prevent in-school transmission given the numbers that we are seeing in community spread. And we want to be sure that everybody that needs to quarantine is indeed quarantining before returning to in-person school. We do need everyone's help in order to keep in person. Again, I can't emphasize enough that our goal is in-person learning. We want to be a district that consistently is able to offer in-person learning. So we often get questions, what can families or parents, guardians do to be helpful? And that we've just captured a few bullets here. Please continue to follow all health and safety protocols, masks, physical distancing, hand hygiene, staying home when ill, doing those things, the health and safety protocols in school and out of school can help mitigate or reduce the community spread that we're seeing right now in Barnstable. And that really addresses the second bullet here in terms of encouraging our students to continue to make the healthy and safe decisions for the community at large. Please, as I referenced before, please follow the Massachusetts Travel Advisory Protocol. If you do travel, it is necessary to quarantine or to receive a negative COVID test in order to return to school. Stay in contact with your school nurse and physician as you have questions. As I had mentioned before, our contact tracing that is being conducted within schools is at times connecting back to gathering events that our students are participating in. The examples I give are birthday parties, sleepover, play dates. We understand that we have been in this situation for a very long time, since March. Our students are anxious and wanting to socialize, and we understand that. However, with the wide community spread in Barnstable right now, we all need to play our part in helping to mitigate and reduce that community spread, certainly so that it doesn't enter our schools. And finally, the flu vaccine. The Massachusetts Department of Elementary and Secondary Education has required districts to be working with families to ensure that students are receiving their flu vaccine this year. As I record this, we have a little bit over 2,000 students who have yet to receive their flu vaccine. So we're encouraging our families to please be in touch with your healthcare provider to make arrangements for the flu vaccine or have the discussion about the flu vaccine. We did offer an in-school flu vaccine clinic. We are in conversations about how we can, I think we gave 180 doses when we did a student flu vaccine clinic. We are in conversations about being able to offer something similar again. And then I want to share, this is the chart that we have been including in a number of our updates. In the terminology here, isolation, this is a term we use for when a student or staff member has tested positive for COVID and they are in a period of isolation. Quarantine is a term that we use for students who and staff members who have been exposed to a COVID case, they are a close contact, or they have returned from a red state and now are in quarantine. Both of these categories trigger remote learning for our students, even when we're in person. And the final column here is intended to be a little more descriptive about what we mean when a student is absent. So if a student is away on vacation, they are considered absent, even though they have the ability to remote in. As we've defined here, if a student is expected to be in person, but they are trying to remote into learning, we're not going to turn the student away from learning, but we are going to mark the student as absent because the expectation is that the student needs to be in person at that time. I recognize we're in a period of remote learning for all right now. And what I'm talking about is in-person learning. But again, we just want to continue. There seems to be some confusion around what we mean when we say a student is absent. We're just seeking to clarify that. I think the best advice I can offer is to please contact, if you have any questions about accessing remote learning and how your child is counted for attendance, to please be in contact with your child's school as we indicate over here. In terms of next steps, we do plan to reopen in-person learning on Monday, December 14th. We're going to continue to monitor our public health data. Being in the red doesn't always mean remote learning, but it is an area that warrants conversation and discussion with the steering committee, that when we're in the red, we want to be sure that we maintain our commitment of health and safety first. And again, I'm going to emphasize, while we are not seeing any evidence of in-school transmission, there is evidence of community spread, and we do not want the community spread to become in-school transmission. Therefore, it is our intent to take this proactive measure, stay remote through December 11th, and then look to open to resume to in-person learning on Monday, December 14th. I recognize and acknowledge that there is a level of frustration out there among parents and caregivers who, when we pivot to remote learning, it creates some challenges within families to be able to do that. I do want to recognize that and acknowledge that and ask for your patience and support when we do need to pivot to remote. We're doing that in order to create and maintain safe and healthy learning environments. The data that we reviewed and the anecdotal evidence we have of students and others who have gathered or traveled during Thanksgiving week, the combination of that and the need to quarantine, all of those factors combined, as discussed by the steering committee, led me to make the decision to stay in remote for next week. Again, it is our intent to reopen in person on Monday, December 14th. The third bullet here, I'm going to continue to emphasize that in-school transmission will result in the closure of in-person learning. So we're going to continue to take proactive measures. We're going to continue to insist on our health and safety protocols within school when we are open for in-person. Again, I think our short-term strategy of staying remote so that we can maintain long-term in school is our goal. If your child tests positive, even while we're remote, please inform the school nurse. Schools are following up the email that we sent out yesterday with school-specific information about remote learning, schedules, and expectations. And just a note that next week was a bit of a different week for us because there are 2 half days next week due to parent-teacher conferences in grades K through 7. There's no disruption to those parent conferences. They will continue next week because they were planned in large part to be virtual conferences. So those will continue, but please note that there are 2 half days built into the schedule for next week as a result of conferences. In closing, I'd very much like to say thank you for your support and understanding as we continue to navigate our instructional models during this period of time. We always appreciate your feedback. Again, I want to recognize that I have received communication from parents who are disappointed in this most recent decision, both due to the impact on what their child's academic learning or social emotional learning might be, as well as the overall impact to the family. So again, we do want to resume to in-person learning. That is our intent for Monday, December 14th. We will have cleared the 14-day quarantine period after Thanksgiving, and we will again, review our public health data later in the week. And that's it for today's update. And again, thank you very much.
In addition to the threat of COVID-19, it is also cold and flu season.
We understand that it is tempting to come to work when you or a family member are feeling under the weather. However,
we ask that for the safety of your coworkers
and our residents,
that you not come to work if you or a family member are ill or feel like you're coming down with something.
Even if your symptoms don't resemble COVID-19.
Cold, flu, strep, and stomach bug germs can be just as contagious.
Please continue to stay the course and keep physical distance.
Wear a mask or face covering.
Washing your hands in frequently touched surfaces.
Avoiding crowds and choosing outdoor activities over indoor ones when possible.
Wearing a mask is only effective to stop the spread of COVID-19 if it's worn properly.
Please know this is making a difference each and every day, and it is not the time to let our guard down.
Thank you.